Hi, my name is Brittany Terpstra. I am a physician assistant at the Community Health Center of the North Country at the Gouverneur location. I am a Gouverneur native. I studied physician assistant studies at Damon College. Prior to that, I got a Bachelor's of Science in Biology at SUNY Potsdam and Associates of Nursing at SUNY Canton. And I worked for 5 years in the Department of Corrections in Attica and Auburn. I've always known that I wanted to be part of medicine. I really like working with an interdisciplinary team, and my years of being a nurse really helped me figure out that I wanted to not only help people but help my community as well, and I thought that I would be better able to do that as a physician assistant working at one of the community health centers. Working in a community health center, especially the one in Gouverneur, is really important to me because I grew up in Gouverneur, and I remember a time where we didn't have specialists as close as Watertown. We had to go as far away as Syracuse to see somebody for specialized care. So I really like the fact that we're bringing the healthcare home now. We're bringing it to a place where you don't need to drive 60, 70 miles away. You can actually see your provider, your nurse, your lab. You can see it all in your hometown. It's right there available to you. What my patients can expect from me as a physician assistant is to want to work together with them as a team and as a unit. It's not just going to be me as the PA, and it's not just going to be you as the patient. I want you to feel like we're a team and we're approaching your healthcare as such. I want to be able to communicate with you freely, and I want everyone to be able to feel that they can approach me and be honest and open, because I definitely feel that's the way to approach healthcare and get the best out of it. I think healthcare begins with the patient himself or herself, and taking charge of your healthcare yourself, that's really where it starts. Outside of work, when I'm not caring for you and your family, I really like to participate in community events. I often go to the farmers market with my folks. We visit the ones in Harrisville and the one in Gouverneur. I'm really looking forward to becoming a 46er. And aside from that, I'm really looking forward to starting to participate in the Walk with the Doc program the last Saturday of every month. The most challenging thing about going through my physician assistant studies was figuring out a work-life balance. I am a non-traditional student. I went back to school after 2 years of working as an RN, and it was actually really hard. And if there's anybody out there who's thinking, do I want to go back to school? Go for it. There's never a better time than now. And I struggled for a little while figuring out whether or not I wanted to go, and I'm so happy that I did. And I'm so happy to have had the opportunity to not only have a work-life balance, but to also have the support system of both my family, my friends, and my community at the time. I'm really looking forward to taking care of patients of all age ranges, from babies to kids, teenagers, adults, and even our older adult population. I'm even looking forward to working with the developmentally disabled and people with both cognitive and physical disabilities. I have a special interest in pediatrics and women's health as well. I'm really looking forward to working with people of all abilities. Growing up, I had a niece with Angelman syndrome and a brother-in-law who's a quadriplegic, so I grew up with a deeper understanding of the barriers that our community faces in terms of wheelchair accessibility, healthcare options, trying to get to appointments from Watertown to Canton to Gouverneur. I feel like I have a better understanding of that, having grown up with my unique circumstances. I love working with kids because it's great to be part of a community and see people grow from these little itty-bitty babies that you once held in your arms to these adults playing sports and graduating school and moving on with their lives, and a couple years then, after that, bringing their own kids back to see you. I think it's amazing to be part of a community where we literally grow with each other and we grow up together and help each other from, birth to becoming adults, and then we repeat the cycle over. I think it's really important to focus on specialized areas of medicine, including women's health in such rural communities, because as of very recently, we didn't really have access to care like this. Women's health is all-encompassing, and it encompasses not only women who want to have kids, but also young women who maybe not want to have kids right now, older women who need to have a little bit of more specialized care as far as mammographies go or breast cancer screening. And women's health doesn't just stop when you're in your 30s or 40s. It goes all the way until you're done with osteoporosis medications and screenings.